Do conditions like diabetes and hypertension affect fertility in men and women? Diabetes and hypertension are very common these days, even in younger individuals. Now we all know that diabetes has a multifactorial cause. Many of the times it's because of the fact that they might be having their parents who are diabetics, and also because of the lifestyle which is there these days. Many people undergo a lot of stress at work. They do not eat at the right time. They do spend a lot of time eating foods which are not usually recommended for maintaining a healthy lifestyle. Now in such cases, the incidence of diabetes and hypertension is increasing, more so in couples who are coming to us for fertility evaluation. Now when you look at diabetes as an entity, we all know that it definitely has a role to play in pregnancy. The most important aim of fertility treatment is to ensure that you conceive, and therefore anything which affects pregnancy is definitely going to affect fertility as well. So it is necessary for us to optimize your sugars and also control your blood pressure prior to when the treatment which is going to make you conceive. Now as far as diabetes is concerned, it is usually associated with metabolic derangement, wherein you can have many hormones play havoc with your system. Now in such cases, we find that they might have problems with ovulation, which might delay conception. In women, diabetes is often associated with PCO, wherein women have very irregular cycles, so it's difficult for them to time their intercourse, and sometimes there is absolutely no release of egg, which may again delays the conception. Now as far as treatment goes, it is quite straightforward. It is necessary for you to control your sugars. Pharmacotherapy is usually secondary. Most of the time, by correcting your lifestyle, ensuring that you sleep for an adequate period of time, and also go for regular morning walks, you will be able to keep the sugars under control. Diabetes has been found to affect egg quality. In patients with uncontrolled sugars, it is difficult for us to start certain injections which might actually worsen your sugars. As far as males are concerned, diabetes has been found to affect sperm quality. Even though it might not have a direct impact on the sperm count or the sperm motility, sometimes it has been found to affect the DNA of the sperms, and therefore such men who go on to have children can have problems in terms of encountering a miscarriage, more so around 6 to 8 weeks. Diabetes and hypertension are known to affect blood vessels and nerves. They are said to narrow down the blood vessels and thereby reduce the blood flow to an organ. This is why we see a lot of patients who develop heart attacks or develop strokes. Patients can end up having problems with erection, and therefore they might not have proper erection to have good intercourse and thereby conceive. In women also can result in various changes in the reproductive organs at a micro level, and therefore it is necessary for us to ensure that the sugars are kept under control, both by lifestyle modifications as well as by using medications to lower the blood sugar levels under the guidance of a trained diabetologist who keeps monitoring the sugars on a very regular basis and ensures that whenever the chance comes of you conceiving, the sugars are well under control so that it doesn't translate into any kind of complications in your early pregnancy.